About 1 in 4 pregnant women will have some kind of bleeding in the first trimester, but at least half will go on to have completely healthy babies. Still, it's important to know what this might mean and how to support your partner. Bleeding can happen for a few reasons. Sometimes it's harmless, like implantation bleeding when the embryo first attaches to the uterus. Other times, it might be a sign of something else, a threatened miscarriage, an ectopic pregnancy, or an infection. The most common reason is what we call a threatened miscarriage. That means there's bleeding, but the cervix is still closed and ultrasound shows a live pregnancy. When this is the case, around 4 out of 5 times, things turn out okay. If your partner experiences bleeding, their doc will usually ask about symptoms like pain, although you should note, cramping similar to what's experienced in a period is fairly common and normal during early pregnancy. They'll ask about the amount of bleeding. Generally, bleeding that soaks through more than a regular pad within an hour for more than a couple hours is the threshold where we start to get concerned. They'll probably do a physical exam, order some blood work to check the levels of the pregnancy hormone beta-HCG, for example, and maybe get an ultrasound. But if the pregnancy isn't in the uterus, there's no heartbeat, or hormone levels aren't rising properly, they might talk about other possibilities, like miscarriage or ectopic pregnancy, and order more frequent blood work and maybe a follow-up ultrasound. You can help your partner by watching for the red flags that should prompt evaluation. If your partner has severe pain in the abdomen or shoulder, is soaking more than 1 pad an hour, feels faint, or has a rapid heartbeat, it's time to go to the emergency room or at the least call the OB. Emotionally, this is rough. It's not just physical. Even if things are going to be fine and there aren't red flags, every pregnant woman with bleeding experiences significant worry, fear, and anxiety. You might be feeling scared, helpless, even guilty for not knowing what to do. After all, vaginal bleeding is another one of those things we guys never have to deal with. All the more reason being supportive and reassuring her goes a long way in helping address the anxiety. Up to 1 in 3 women experience post-traumatic stress, anxiety, or depression in the first month after early pregnancy loss. And while symptoms often improve with time, many still struggle months later.